Well, good morning, everyone. Bob Ravenscroft, Vice President for Advancement at Bryan Health for our June 8th media briefing. Real quickly, after I present some stats, John will come up, and then we are going to share about a 3 to 4 minute video that will come through over WebEx and Facebook, and it is with Becca Milroy. She's a critical care nurse who has been working with many of our COVID-19 patients to give you a perspective on what she is seeing with patients. For members of the media, this is about a 13-minute long interview that we packaged and will send out to you. Covers a lot of ground, so you guys can take it whichever direction you want. So we'll just be showing an abbreviated portion during this briefing today. Again, she's dealt with many COVID patients, those of all ages. Just kind of brings a human element to what it's like to deal with this on a daily basis. Our midnight census was 401. We have now administered 10,472 COVID-19 tests, and it is resulting in 1,411 positives and 193 pending. So John will come up when he's done with his remarks. He'll roll the tape, and then we will entertain questions after that.
Thanks, Bob. I wanted to share some numbers, and actually some pretty good numbers, that in-house currently we have 13 COVID positive patients, 9 from Lancaster County, 4 from outside the county, only 1 person that is pending results. And then we have 7 that are on ventilators, 7 are in our ICU, 3 are in our progressive care unit, and 3 in our general care unit. But for those of you that have been keeping track of the numbers, this is a good sign from back on June the 1st, we had 30 positive COVID patients in-house, and that has been declining by the day, and now we're down to 13. So good trend to be seeing. But as we keep telling people, still continue to social distance, wear masks. This is what's allowing us to be successful in taking care of this virus in this area. So before we do take questions, as Bob commented, we're going to go ahead and roll a video of Becca.
My name is Becca. I am a nurse on the Med-Surg ICU. Currently, I've been taking care of the coronavirus patients on the dedicated airborne isolation unit. We're used to having families at the bedside, and we can kind of bounce things off them, and they're really involved in the care. Not having families there is not only hard for our patients, but also us. We've been using FaceTime a lot and talking with families through FaceTime, setting up a lot of meetings that way, trying to keep them involved and to still be able to see their loved ones, even if patients are on a ventilator, and trying to keep people connected and knowing that their loved one is really sick in the hospital. When we can set up those FaceTime meetings and phone calls and everything like that, people are super excited, and they really enjoy to visit with their loved ones. And we've had a lot of really cool experiences. Like, I had a more difficult conversation with a family after a family was told they didn't think their loved one was going to survive the day. And so FaceTiming them so that they could see their loved one and tell them goodbye, and then have like their child tell them, I wish that you could be there for my high school graduation. Something like that is really hard, but that patient actually got better, and he was able to FaceTime during his son's high school graduation, so that was really cool. I would say most of the patients that I've cared for with COVID so far, the ones that have been the sickest have been probably between 40 and 60 years old. So they're young. And I've cared for a patient that was younger than myself, and who was probably one of the sickest patients I've ever cared for. That's hard because you see their pictures of their families. We'll put them all over near their bed, and you see them as a person, and you see their family, and you hear stories from their families about who they are, and you kind of can see past them as the person in the bed, and you think about their life and all the things that they have done, and and so it's hard. It's awesome. I wish that I physically could see the person go see their loved one. We see the people leave the double doors on the other side, and oftentimes they're going to rehab or maybe going home. And we're just in our unit, and so you kind of think about what that interaction must be like, and I bet it's just awesome, because all we see really is the FaceTime call, and even that always brings out a ton of emotion. It really is why we do our job. We just want to get people better.
What struck me most when I had the pleasure to sit down with her was when she was describing the age range of the patients that they predominantly see. We've shared that those with underlying conditions and the elderly are very susceptible for very serious disease progression. But Becca shared, it was people 30 to 50 is the most, probably the dominant demographic that she's been caring for. I'd like to put all of the credit back on the community for social distancing. A lot of us are wearing masks out there, and just the directive health measures that were put in place really did help us flatten the curve. John, do you have anything else? You got it. And he said, I got it with that one. Well, I think we're all going to find out, as we said last time. We completely understand why people felt the need to get out there. And as an organization, applaud them for standing up. John and I were talking, the best thing that could have happened, they were windy days when people were out there, which will help decrease the viral load. But we're not going to know until a few weeks later.
Kind of depends from the positivity rate, but when people get ill enough that they're either presenting at the hospital or they're getting a note from their doctor or an order from their doctor to come to our urgent care center, we're seeing a higher positivity rate. Whereas now, if you look at some of the access to test, you have asymptomatic people coming to have their test done, and that's why you're going to have a less positivity rate. And if you recall, we also intentionally went into what might be called hotspots to make sure we were getting individuals access to the test. That's probably a reason why you'll see a higher positivity rate from the people that we have tested.